Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. In our October episode, we talked all things menopause with Dr. Samantha Dunham, co-director of the Center for Midlife Health and Menopause at NYU Langone Health. In our October keynote, Dr. Dunham explains why the gap in care for women experiencing menopause is narrowing and lays out small lifestyle changes that can relieve symptoms and boost overall well-being. And one more reminder before Breast Cancer Awareness Month ends. If you're a woman age 40 or older, schedule your mammogram today. Remember, early detection saves lives. You had mentioned earlier that there's a gap in care for women seeking help for menopause symptoms. I think your center is helping bridge that gap. Why do you think that there still is a gap in care for women?
I think some of it, or a lot of it, is based on that study. So from 2002, it's like 20 years long shadow. This study was released to the public before it was released to the healthcare professionals. And it really sent a shudder through everyone who was taking hormones. Hormones prescriptions dropped radically, almost overnight. And there wasn't a lot of information. It turned off in terms of educating young doctors, in terms of patients using hormones. It was, people really swung in that other direction. And I think it's just taken this long to kind of let the pendulum swing in the other direction and to appreciate, to learn more. There's been a lot of research since then, research that tells us about the safety of this treatment and the effectiveness of it. And I think at the same time, women are talking more about what's happening to them, and they're engaged, they're in the workplace. It's a crucial time in life, and they're not taking the back seat. So they're expecting solutions. Medicine's just one part of this, right? I mean, it's the whole story. So, it comes down to really choosing nutritious food, right? Improving your sleep. Like if sleep's been an issue, it's going to become more of an issue, and you've got to address it head on. If there's too much alcohol in your life, you're going to pay for it at this time in your life. And, that needs to be reeled back to. This is the time in life when our physiology is changing. It's important to look at all aspects of health. And it includes really thinking about maintaining your well-being for exercise, maintaining well-being for food, avoiding too much alcohol, certainly not smoking if you're smoking, and making sure you have a circle of friends around you, because these are the things that keep your brain healthy long-term, keep your body healthy long-term. Hormones can help with symptoms, but they're not Teflon for going forward, for aging.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.